What is distal radial access? Distal radial access refers to a vascular intervention technique where the radial artery is punctured at the snuff box or at the dorsum of the hand. The artery is typically palpable at the intersection of the thumb and first finger over the bony structures of the snuff box. The needle is directed towards the point where the pulse is most strongly felt. Ultrasound may have an advantage over tactile sensation and can also be used to measure the vessel diameter. The puncture technique is similar to that used for conventional radial artery access. A through-and-through puncture is not recommended, particularly if the artery is punctured at the snuff box due to notable pain caused to the patient. Advantages exist to using distal radial access compared to the traditional transradial method. The first is that the left hand of the patient can be easily used, with the operator still puncturing from the right side. There is also improved operator and patient comfort due to the lack of forced supination of the forearm and a decreased need for shorter operators to bend over the patient. Obese patients can be easily punctured, and shorter hemostasis times are required of the artery post-procedurally, thus facilitating outpatient interventions. Other reasons for choosing distal radial access include if a proximal puncture had led to a hematoma or vessel spasm. Distal radial access can also be used if the reopening of a radial artery occlusion is required, or to protect the radial artery for the creation of a dialysis fistula. Further, in patients who have undergone coronary artery bypass grafting, distal radial access is more ergonomically comfortable in comparison to the standard left transradial approach, due to the lack of bending over a patient to access a forcibly supine wrist and arm, particularly if he or she is obese. It is also particularly useful in elderly patients undergoing percutaneous coronary interventions.